Assalamualaikum and good morning to all my clinical instructors and lecturers. Today I would like to present a case on the nutrition management of human immunodeficiency virus HIV, or the other name is RVD. So I start with the relationship between the HIV and the patient nutritional status. What often occur to the HIV patient is they face insufficient nutrient intake, malabsorption and so on, and will lead to nutritional deficiencies with macronutrient and also micronutrient deficiencies, and then lead to increased oxidative stress and eventually will increase their HIV replication and accelerate the disease progression. So the next is the table of contents according to the NCP. I start with the client history. Patient is Mr. TL, 32 years old, Chinese, and patient previously worked as a medical assistant at HUKM, but currently not working. For the family history, patient father diagnosed with hypertension and CAD. For the patient medical history, on 1994, which is patient is 6 years old, patient has done tonsillectomy, and then at 18 years old, patient do appendectomy, removal of the appendix, and on 2016, patient was diagnosed with RVD with history of intercourse with multiple partners but with safe sex precaution, and patient was admitted at HUKM on 2020 for treatment. And for the anthropometry, patient weight history is 62 kg on the past 4 years, 52 kg for the past 1 year, and patient current weight is 48 kg. For the percentage of weight change, patient lost 14 kg in 4 years and patient lost 4 kg in 1 year, which is calculated 8% of weight loss in 12 months. And this indicates patient has insignificant involuntary weight loss based on Collins and 2003. And the patient BMI is 17.0 kg per meter squared, which is underweight according to WHO 1995. And patient elderly body weight at BMI 22 is 61 kg, and patient adjusted body weight, which is the weight used for calculation, is 53 kg, which is +2 from the calculated BMI based on the Coolidge 1970 reference. And then for the biochemical data, patient albumin, white blood cell and HP is normal, but patient total protein and hematocrit is on the borderline, might be because due to the malnutrition. And patient viral load, CD4, CD8 and percentage of lymphocyte indicated that patient has progressed to the 8th staging. Okay. For the nutrition focused physical finding, patient temperature is normal, febrile 37 degrees Celsius, patient blood pressure normal 120/84, patient heart rate 92 is normal, and patient stool is also normal with Heme negative. And for the nutrition focused physical examination, patient is thin, patient had edema, and then this might be due to the zidovudin, which is the therapy for HIV patient that relate to induced macular edema, which is macular edema is the build-up of fluid in the macula, which is in the center of retina. The patient with macular edema usually have watery eyes, and patient has sore mouth and also throat with erythematous with white patchy exudate. And according to the current research, oral problems such as dry mouth, ulcer, gingivitis, and oral candidiasis, and so on are the effect both by the antiretroviral therapy and also the side effect of the infections itself. And then for the food and nutrition history, patient reported has food allergy, and patient can only tolerate small amount of milk at one time, and patient does not like fish and coffee. Patient is a picky eater, and the meal is prepared by her mother. Based on the diet recall, patient current energy intake is inadequate, which is only 1000 kcal per day, with protein intake 32 gram per day, which is only 0.7 gram per kg body weight, and carbohydrate 62% and fat 24%. For the medication, patient currently prescribed with fluconazole, which is to maintain therapy to prevent streptococcal disease in AIDS patient, and will give side effects such as headache, abdominal pain, and in severe cases will cause diarrhea, nausea and vomiting. And patient also prescribed with lamivudine and zidovudine, which is as antiretrovirals, and these are a few side effects that patient might have. And For the nutrition diagnosis, patient has inadequate energy protein intake related to pathological or physiological causes that result in increased nutrient needs due to prolonged catabolic illness, as evidenced by progressive weight loss, which is more than 5% of the usual weight over a period of 6 to 12 months, and estimated inadequate current energy intake and protein intake based on diet recall, which is 1000 kcal per day and 0.7 gram per kg body weight protein per day. And for the intervention, there are a few goals. First is to optimize the energy and protein intake in order to improve the patient immune function, to reduce the incidence of HIV-related complications including metabolic disorders, attenuate disease progression, and improve patient survival rate. And second is to improve quality of life, and third is to reduce and minimize the symptoms. And for the estimated needs for energy, I use two formula. First is quick method. I get 1900 to 2900 kcal per day. And for the second one, I use Harris Benedict, and I get around 2300 kcal per day using the activity factor of 1.1 and stress factor of 1.5. And I choose this patient around 2000 kcal per day, but in hospital there is no 2000 kcal per day of energy prescription, so I give patient about 1800 kcal per day regular hospital diet with B, non-spicy food, because patient has oral issue, which is with the ulcer and also with the erythematosus, and I thought patient cannot eat the spicy food. And then for the protein, I prescribe patient with 64 to 79 gram per kg body weight, which is high protein according to Aspen 2006 for a stable HIV patient. And for the nutrition intervention, first I will indent patient with 1800 regular hospital diet, non-spicy, and advise patient to finish the hospital diet. And then this will provide patient with 1800 kcal with 76.5 gram protein per day. And second, to optimize the patient energy and protein intake, I prescribe patient with ONS as the dilution, 2 scoops of Ensure Gold with 100 ml H2O 4 times per day at breakfast, morning tea, afternoon tea, and before bed. And this will provide energy of 352 kcal per day with protein 14 gram per day. Why I choose to give 2 scoops with 100 ml H2O per serving? Because patient claim that patient cannot tolerate with high amount of milk at one time. So I plan to give patient only half glass of milk each meal. Okay, for the to improve patient immune function and to enhance immune function, I advise patient to increase fruits and vegetables intake by advise the patient to finish the fruits and vegetables served in the ward. For the monitoring and evaluation, I would like to monitor patient weight and lab data such as total protein, hematocrit, hemoglobin, and so on, diet intake, and also the patient compliance to the ONS prescribed. And for the discussion, patient is categorized as significant weight loss because significant weight loss is defined as loss of 4.5 kg or more than 5% of the usual weight over a period of 6 to 12 months, especially when it is progressive. Like this patient, the weight reduction is progressive. And for the next one, the increased resting metabolic rate RMR lead to increased energy requirement, and high protein diet is strongly recommended for patients living with HIV to fight their infections and to support their immune system and to prevent muscle loss and also improve their quality of life. And then patient with HIV also related to malnutrition and macronutrient deficiencies such as iron, folic acid, zinc, selenium, and vitamins such as vitamin A, C, and D that affect the immune system also. For the question, the first question is, does patient consume enough food, and identify anything from his history that indicate he is having a difficulty of eating. So based on the diet recall of current intake, patient does not consume enough food, as his estimated total energy intake per day is inadequate, which is only 1000 kcal per day with protein 22 gram per day only. And patient also reported that he only can tolerate small amount of milk at one time and does not like fish and coffee. Plus, patient also complained he is a picky eater. And for the question 2, I have created a suitable menu plan for this patient. And this will provide energy around 2200 kcal per day with plus protein 80 gram per day, including the ONS prescribed. Okay, so this is my reference. Thank you.